Hello, I'm your host, Neil Howard, here on Health Professional Radio. I'm going to have a conversation with the Bele Umanigo of Lagos, Nigeria, and she's the grand prize winner of the 2018 C3 prize. She's joining us here on our program to talk about her work. She created a culturally relevant and very easy to understand digital audio series about breast cancer for patients in Nigeria. Welcome to the program, Bele.
Thank you so much for having me.
A bit of background about yourself, and then we'll talk a bit about your personal connection with cancer, okay?
Okay. In 2009, I started an organization called Run for a Cure Africa. And the onus of starting the organization was really from my mom's experience with breast cancer. And so I just wanted to create an avenue where women could get detected on time because, with her, the first time she had it, they said they were able to detect it early. And so I just wanted to give women, an opportunity to, catch it early as well so that their survival, the chances of survival could increase. And so, whenever you start out something, you start in with the intent of just solving one problem. But as we went further along, we realized there's so many issues that needed tackling, as far as breast cancer management in Nigeria. And so the organization has definitely evolved since that time. And we're really not only trying to provide, opportunities for women to get detected on time, but then just, making the journey less stressful and less confusing for women. And that's where the Stella's Oncology C3 prize really came in and gave us that extra boost. So
you've had this idea to, educate women in Nigeria about breast cancer and provide some support and some different avenues through an audio series. Talk about this idea and how you won this prize.
Well, the reason why we started, or I thought of the idea to do the series, was because it's different from just telling people, oh, this is why you should do this, or this is how you should do this. I find that, in Nigeria, if you pass on information through a story, that it sticks a lot better rather than just giving people information. So when the C3 prize presented itself, I was like, this would be an awesome opportunity to get that support that we need in order to produce this series. Because, production is tasking, but it's also expensive as well. So, it's kind of like it came on at the best time. It really did. It's kind of like we had a patient who, through her breast cancer, we were able to provide her financial support for treatment. But after we had essentially opened up an account for her at the local hospital and let them know that we were going to be supporting her treatment, she stopped midway for no other reason but that she felt better and she didn't feel like continuing on with the treatment because in her mind, she had done enough. And sadly, when the cancer spread, she returned back to us, saying that she's sorry. She didn't know, the importance of completing her treatment. And unfortunately, she passed on. And so, that kind of made us realize, though, we're telling these women, you have cancer, this is what you have to do. I don't think that they can understand it. So by creating a series whereby we put it in a perspective that they can understand, we believe that it's easier for them to understand the severity and the consequences of not getting detected on time, but then also following through with treatment. And so when the C3 prize presented itself and said it's a non-treatment idea, for you to affect cancer care, we were like, that's exactly what we want to do through this series. So we put in and thankfully, we won. So, yeah.
What's next as you've got this funding now?
Well, it's very important, naturally you just don't want to jump in and start writing the script. We have to authenticate the journey. And so with winning the C3 prize, grand prize last year, the first thing we did is we want to be able to validate what it is that we're putting out through the series. It's one thing to say this is an experience. It's another thing to have research that backs it up. So we went through a series of focus groups where we got the stories from actual patients understanding what their disease journey has been like and what challenges they faced. And then working with the healthcare professionals that have, that one-on-one face-to-face experience with the patients and what they would have liked or what they want the patients to know. And so from that, we created a script and we're producing it so that we can put it out through radio. So everyone in Lagos and in Nigeria can have access to this, to these episodes, but then also giving it to our patients through our patient navigation program. So they also have access to the series as well. So we're hoping to go live by the 22nd, which is next Friday, and, just get some really wonderful feedback and then just, keep going with the series. Hopefully, if the reception is there, which we believe that it will be, we can have other seasons. So this is season 1 that we're putting out. And so we're hoping to have other seasons after this one.
Well, it's been a learning experience for you. What advice do you have? And, now that you know a few things about this prize and how this can help others, many others are developing ideas now. What advice would you give them?
Well, the advice that I would give to anyone that's wanting to put in for the C3 prize is, number one, you have to be able to measure your impact that you're going to have on the cancer care journey. Because I think this year, Astellas is really wanting to focus on the cancer care journey. So you have to be able to articulate what impact you're going to have on that journey. Number two, no idea is too small. When I went in for C3 last year, I was, a little intimidated because I thought my idea wasn't as tech savvy, but I knew that in my environment that was going to be how I could reach the most people, how I can make the most impact. So, I put in, and thankfully, the judges were able to see that while, there's not a lot of tech involved with it, at the end of the day, it's impact, and we need to impact the patient journey. And they were able to see that through this series, not only could we impact the patient's journey, but we could also get to the larger community and help them understand the cancer journey in Nigeria. And that helps to break down the stigmas that keeps women so quiet. So, again, number one, you have to be able to articulate your impact, but then also, number two, no idea is too small. Put in your idea.
And where can listeners go and actually submit their ideas and learn more about the Astellas C3 prize?
They could go to submit their Astellas Oncology C3 prize idea. They could go to www.c3prize.com. That's the letter C, the number 3, prize.com.
Ibele, thank you so much for joining us here on Health Professional Radio.
Thank you so much for having me.
You've been listening to Health Professional Radio. Transcripts and audio of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to this podcast on iTunes, listen in and download at SoundCloud, and be sure and visit our affiliates page at hpr.fm and healthprofessionalradio.com.au.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.